You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, gum disease. According to my first guest, no more bleeding gums, bad breath, loose teeth. And we're talking about a new breakthrough, using a laser to kill the bad bacteria, the source of the gum disease. With us, we have an expert on the topic, Dr. Mark McCawley. Dr. McCawley, welcome to the program.
Thank you so much. It's great to be here.
Now, for people that don't know your practice, and I know you brought some photos, I mean, who's the typical patient? Because you're a periodontist.
I am. I'm a periodontist. So typical patient would be anybody with bleeding gums, missing teeth, recession, long teeth, bad breath. Basically, gum disease is our big, that's a big thing that we treat there. That's periodontitis, hence the periodontist. Okay. And we treat that, and anybody who has any of those symptoms, any of those diseases, and wants to get better, that's who we treat. That's our ideal patient. And what we do is it's different than most other periodontists. We actually use a laser to go around the teeth and eliminate that bad bacteria that's causing the gum disease. So we get down to the source of the gum disease, which is the bacteria that causes it, and we're able to eliminate it. And this is pretty much the only treatment out there that's effective at doing that, and we actually did the research on it that shows that this can eliminate the bacteria, and no other treatment out there is really effective at it. So we also do plenty of implants in our practice because we have patients coming in, they have missing teeth, or say they're wearing dentures, and not a lot of people like dentures. So we're able to actually place implants that can either fixate that denture or completely replace their teeth with teeth that, instead of feeling like a plastic denture, feel like your own natural dentition, natural teeth, and we're able to make them a whole lot happier that way.
Now, another thing you're big on is treating cold sensitivity, people with receding gums. You have a new way of treating that as well. Which at the end of this segment, I want to make sure that we talk about this.
Of course, yeah.
But who's that patient that you see?
Patient, anybody who, if you see more root showing, longer in the tooth as they call it, those are the patients that we see for that pinhole technique is the technique we're referring to. And we're able to actually pull those gums down and cover the roots, because if you take a sip of cold water and it makes you jump, that's not good. That's not healthy. You want to actually see if we can pull those gums down, cover those roots, because it's the exposed roots that are actually causing that sensitivity, and that's why you can't eat ice cream.
Now, is this true? I guess how it's typically done to treat receding gums is you take some gum tissue from the roof of the mouth.
Oh yeah.
And then you patch it with stitches onto the gum that's receding.
Yep. Yeah.
And you don't do it that way.
We do not do it that way. No. I mean, the way...
Which is a painful procedure.
Oh, that's very painful.
Right?
That's very painful. Now, because back in the day, before techniques like this were invented, that's how they did it. You had to take the gum from somewhere to thicken it up, and they just cut the inside of the gum and stitched it on the outside, and it's painful. It's very, very painful, because the roof of the mouth, it's one of the more sensitive spots in your whole mouth, and if you cut it, it's going to hurt, and it's going to hurt for weeks.
So in this technique, if you have receding gums, you're actually kind of just pulling them down.
We're able to
didn't you
pull them
always
down.
know you could do this?
We
couldn't get it to stay down
We couldn't
before?
get it to stay down. That's the thing. You could pull the gums down, and without taking that gum tissue from the palate, and it wouldn't work that well. This, we know it works well because we have studies on it now, and I was actually part of some of those studies, and we know it works for a while. We know it's long lasting, and that's important.
Okay, good. Now we're going to move on to today's topic, which is treating gum disease. So as a working definition, somebody watching this, what is gum disease? Like, what are the symptoms? How do you know if you have it?
How do you know if you have it? I mean, long teeth, bleeding gums is a big one. Your gums are not supposed to bleed.
No, but flossing, a little bit of blood is okay?
No.
Or no?
Any blood in your mouth with flossing, that means you've got some form of gum disease. It may be gingivitis, it may be the more severe periodontitis, but you do have gum disease if you do have blood in your mouth. For instance, I mean...
So is gum disease a bacterial infection of the mouth?
It is.
Is that what it is?
It is. It's an actual bacterial infection. The bacteria, you get infected somehow, you pick up the bugs from somewhere, and they get into your gums, they get into your mouth, and they can actually destroy the bone and destroy the gum around your teeth. And that's why you see people...
Is that why people lose their teeth?
It is.
Is that
it's
the number one reason?
That's probably the number one reason that people lose their teeth is periodontal disease.
And now you can wipe it out with a laser.
You can wipe it out with a laser. You can eliminate that infection more effectively than any other technique out there.
Okay, so let's start there then. Okay, so there's two ways, I guess, to treat gum disease: the bleeding gums, the bad breath, the loose teeth. So there's a standard way, and then there's a way you're doing it. Tell me a little bit about both.
Well, the standard way was actually, that was the way I learned and most people learned when they were in school how to do it, and that's how the profession's been doing it for years and years and years. But what they do is they actually cut away the gums and they grind down on the bone and they try to stitch it all back together. And
so they're
the way
opening
that
up the
sounds,
gums, what, to access, to clean them better?
They open up the gums to actually access the tooth roots, to scrape away at those tooth roots and grind away at a little bit of bone, and then they stitch it all back together. In case you didn't realize,
that's how it's being done
painful.
right now.
That's where it's being done, all over the city, all over the state, all over the country even. That's where thousands of these procedures are done, probably daily.
What's that called, by the way? Like gum surgery? What do they call it?
That's called osseous surgery, because you actually, osseous means bone, you actually remove a little bit of the supporting bone in order to make everything fit together and reduce those periodontal pockets is what we call them. And we'd actually do one side of the mouth at a time because doing the whole mouth would be way too much for anybody. So we'd do one half of the mouth and then we'd come back and try to do the other half. Patients wouldn't want to come back. It'd be too painful. It'd be way too painful for them. So I mean, this old procedure, it takes weeks to really recover from. And the sensitivity, that can last for months and months, and it may be permanent. So you get more sensitivity with this procedure, with that old procedure.
Okay, so the laser, how is it different? How are you doing it that's so different?
We're doing it differently because instead of cutting, suturing, sewing, all that, we're able to do all that instead of with a scalpel, with a laser. We're able to gently go around these teeth and remove the bacteria, the bad bugs that are actually causing this disease, and it ends up, and the results are amazing. When you remove that bacteria, you remove the infected tissues, and you're able to actually regrow some bone with this too. It's fantastic. We're able to regrow bone instead of cutting and grinding it away.
So the bleeding gums, the bad breath caused by this gum disease, how soon does that go away?
It should go away pretty immediately. It goes away because if you eliminate the bacteria around the teeth, and as long as you keep the tongue and the cheeks clean, all that, then you're able to actually remove basically all the bacteria in the mouth, all the bad bacteria in the mouth. And as long as the bugs are gone, the bad breath is gone, the bleeding gums, they obviously after the healing period, they're gone too. And it's great to be able to see that transformation with these patients.
I guess the traditional way to get rid of gum disease, the surgical way, is very painful. What about this laser procedure? You call it LANAP. What about pain there?
As for the LANAP, the pain is minimal. I mean, the pain is, compared to the old procedure, it's maybe 1/10 the amount. It's so much lower. I've had many patients, they return to work the next day, and it's great. I've had many patients say, you know what, I barely even felt it. It was incredible. So you'd never see that with the old osseous surgery. You'd never see that. Trust me, they'd be cursing you for weeks.
Well, logically, it makes sense. You just go around the mouth with the laser. But how does the laser hit the bacteria, the bad stuff?
Well, the specific wavelength actually targets the bad bacteria. It targets those dark pigmented bacteria, and it's able to selectively kill those bacteria, remove a thin layer of the diseased gum tissue, but it leaves everything else intact. It doesn't hurt the bone, it doesn't hurt the actual connective tissue, which is the thicker gum around it. So it's able to actually target the bad bugs and where they're hiding.
Okay, now, there's a video that you brought. I guess every new patient that goes to your practice that has gum disease, the bleeding gums, the bad breath, the loose teeth, you do a microscope or a swab of their mouth and you show them the bad bacteria that's swimming around in their mouth. Is that right?
Yep, that is true.
How does that work? Like, what is it?
Well, we know that there's certain good bacteria that everybody's supposed to have in their mouth, and there's bad bacteria that you see in periodontitis or gum disease. So if we take a sample from these patients and they have the bad bacteria, and they have the pockets, they have the bleeding, we know they have gum disease.
So what do you do? Right there on the spot, you swab the gum.
We actually end up, we borrow some bacteria from their mouth, we take that little sample, we put it on a slide, and then we go into the back, and I have one of my hygienists look at the bacteria while they project it onto a monitor directly in front of you, so you get to see what you have. You know that I'm not making it up. It's right there in front of
Really?
you. And then if you see some of those bacteria that are shaped like little corkscrews, those little guys are real bad to have because they burrow into your gums, and that's the reason you actually get the bleeding gums, is because of this motile bacteria in your mouth that's able to poke holes in your gums, tear your gums apart essentially, and then it eats away at the bone. We also see plenty of parasites. Lots of these patients that we see have amoeba. They've got some trichomonads. If you look those up, you know you're not supposed to have those. They're terrible for you.
And you see those all the time?
We see those all the time.
So let's take a look at this slide.
This is what we show the patients. This is what we can actually see is going on inside their mouth. And you can see some of these bacteria, they're just darting back and forth. Imagine having millions of those in your mouth.
So you know the shape of what we're looking at? Like, and you called those, because you showed me before we came on
they're
here.
spirochetes. Those are the ones that are traditionally associated with a lot of periodontitis. And there's fancy scientific names for them, treponema and sorts like that. But what we're looking for is different morphology of bacteria. Essentially, the more active it is, the worse it is.
So what do people say when they see these slides?
A lot of people, they're in disbelief because nobody really thinks that this is going on in their mouth. I mean, it's something that you just sort of assume, whatever, I've got a little bit of bleeding. Maybe it's because you were poking at me too hard. It's not because of that. It's because of this infection. This infection's actually what ends up causing it. So I've had plenty of patients that say, when can you get me in? Can you get me in today? So it's something that it causes a change in these patients, because you can have a dentist tell you that you have gum disease all day long, but until you actually see what causes gum disease, it doesn't really cause that reaction that you need to actually get it done.
So after you go around their mouth with a laser, what does the slide look like at that point?
You're going to see dots and lines that are not moving. So essentially, that's the good bacteria. You want dots and lines that don't move. And because I check myself, that's what I have.
So you have no...
I have none of the bad stuff, because every so often, you want to check. You want to check. So that's what you want to have.
So you can give a patient a before and after.
Oh, yeah.
Like 2 weeks later?
We typically will wait a few months for it, because we want to make sure that their oral hygiene's under control and everything like that. But we'll typically do it maybe about 2-3 months after. We'll show them their bacteria.
You re-swab their mouth.
We'll re-swab their mouth
to see if it worked.
And every follow-up after that, we will swab their mouth to make sure that they don't get reinfected. Because with this bacteria, I can get rid of it, but this infection's sort of like pneumonia. You can cure pneumonia, but you can catch it again if you're not careful. So we teach them how to do everything that they can to make sure they don't get reinfected. But you do see some patients, they can get reinfected, and it's from family members, anywhere you're swapping spit from. So you want to be very cognizant of where you're swapping spit.
Now this popped in my head.
Yeah.
So and people just tuning in, we're talking about lasers to treat gum disease rather than the traditional surgical procedure. Now, have you done any comparisons where the traditional way, where they cut the bacteria out and then you put it under slides a couple of months later? What does that look like as compared to the laser?
It's going to be night and day different, because with that traditional surgery, you're trying to cut it away and scrape it away, but a lot of times you don't remove all the bacteria, and these bacteria...
It's invisible to the eye, right?
It's invisible to the eye. Unless you look for it, which most people don't look for it, unless you really look for it, you don't know really what's in there. So if you just cut and scrape it away, you're not really going to remove it all,
so
and then you get reinfected,
those...
and then the bacteria can come back. Because in the study I was actually a part of, we compared scaling and root planing, which is the deep scraping, the deep scaling that people always say they get, versus the laser. And what we found was, in all of the scaling cases, there was still bacteria remaining.
All the bacteria was there?
All the bacteria was there. It was at a lower level. You're able to remove some of the amount, but you're not able to actually effectively eliminate it. So with the laser, it was, in basically almost 90% of the cases, there was 0 cultivable bacteria remaining. So it was, for all intents and purposes, disinfected. So can you put that slide back up again?
Okay, the video.
Yeah. So what you're seeing here is those bacteria and the actual parasites as well. So those parasites and bacteria, if you treat it with...
those big ones moving.
Yeah, those big ones moving around. If you treat it with a certain antibiotic, say the most common one prescribed is amoxicillin, that wouldn't touch them. It wouldn't touch them for weeks and months on end. You'd have to take a month's worth of antibiotics to make it actually make a difference there. Whereas you want to actually target what type of antibiotics you use compared to what you find in their mouth. So for
you're
one
giving
case,
them medicine just to kill the particular bug problem they have in their mouth.
Exactly. So there's certain antibiotics that work better in certain types of infection, and we're able to actually discern what type of infection by what we find on that slide. And the slide is a great technique. It's a great method to actually show the patients what they have, as well as it teaches me what they have too, because I'll treat every case differently.
Now, I've interviewed your father, who's a periodontist, and we've talked on the telephone, and you're doing these, swabs to look at the bad bugs in their mouth. So I talked to another periodontist about this. I said, are you doing that? Are you swabbing the mouth? They go, no, I'm not doing it. I go, why? And they said, well, I don't think it's that necessary.
Yeah, a lot of guys.
Because most periodontists aren't doing this?
Most periodontists do not. No, there's a small amount that actually use the microscope to look, and it's a great adjunct for us to be able to basically diagnose these patients, because every infection is going to be slightly different here. Everybody's different. Every infection's different, and unless you really see what they're infected with, you can cut and scrape all day long, and you're not going to remove the bacteria.
So laser, get the laser.
Get the laser.
The bad breath. Why the bad breath associated with gum disease?
Well,
and how does the laser take care of that?
Because it's the bugs. You get an infection. Say you got an infection in your arm, it's going to smell. Same thing as your mouth. If you get an infection in your gums, it's going to smell. Some of these patients have pus coming out of their gums. They can actually taste it. It's not so much as bad breath as it is bad taste in their mouth. Some of these bad cases. So if you remove the infection, you remove those bad bacteria, you remove the bad breath almost immediately there.
Now we are short on time, but I want to ask you. You say you can save teeth. That means people that maybe would have been told you need an extraction, you're going to lose the tooth, you're saving the tooth using the laser. Help me understand how that works.
Well, what we end up and do with the laser is we're able to remove that infection and make that area healthy again. Whereas previously, with the old school treatments, you weren't able to really do that. You actually removed some support around that tooth, whereas we're rebuilding some of that support. So I had this one lady who came in, and her dentist, and actually two dentists, had told her that she was going to lose all of her teeth. The dentist said, you know what? Give these guys a shot, give these McCawleys a shot, maybe they can do something here. So she came in with low expectations, figured she was going to be in dentures for the rest of her life, have to lose all of her teeth. We were able to we got her in, we swabbed her mouth, we took some numbers, we took some x-rays, and with that swab we were able to see exactly what type of bacteria she had, bacteria and parasites. So we knew that we could effectively treat this. So what we did was we used the laser with the Lanap, and we're able to eliminate all that infection around her mouth, kill all those bad bugs. The teeth ended up, we regrew some bone around them too. The teeth firmed up. Before she couldn't even bite into an apple without fearing that her teeth were going to end up coming out. Now she's got no bleeding gums. She's got firm teeth, healthy gums, and she's very, very happy because she's able to keep her teeth for a lifetime, and that's our goal. Our goal is to save smiles for a lifetime.
Okay, now so I understand this correctly. Okay, so you got the gums. When you have underneath the gum line is where all this bacteria lives, right? So the gums start moving away from the tooth. Is that why they're getting loose?
Yeah, what ends up
kind of what's going on?
Yeah, that's kind of what happens. The bacteria get into the gums and they infect the gums, and it's like any infection. Everything puffs up, it gets inflamed, and then it starts eating away at the bone. And the bone's what actually supports the tooth.
Is that right?
The less bone you have, the more loose these teeth are going to get. And it only happens till a certain point until the tooth comes out. So what we're able to do, we're actually able to go around these teeth and actually disinfect around them, and then a lot of times we're able to get some bone regrowth and tissue reattachment to those areas so that these teeth were, before they were moving back and forth, they were really, really loose, they're able to firm up.
And so that's why, like that one patient, she got to save all of her teeth.
She got to save her teeth. And
is that routine?
That's routine. We're able to do that most times.
No, your buddies that are periodontists that don't use a laser, when you tell them this, what do they say? How could they deny that this is?
The thing is, I mean, a lot of them, they're in certain situations where they're not able to invest the time, invest the money to get
that's
it.
fair.
I mean,
So look for a dentist that has a laser.
Look for a dentist or ideally a periodontist that has it, because that's the person who's able to effectively do it.
Does it cost more to go to a specialist like you?
Actually, in the long term, it's going to cost less because you get it done right the first time. You're able to disinfect around here, kill all the bad bugs, and then as long as you've got a healthy mouth with regular maintenance and oral hygiene, you should be able to keep these teeth for a very, very long time without any retreatments or new scaling and root planings. You want to be able to keep these teeth for a long time, and we're able to do that routinely.
So, I Googled it. There's more than 20 million people, sometimes says 30 million people that have an upper lower denture. If you got to those people first with the laser early on in their life, do you think you could have saved their teeth?
Oh, yeah. It's obviously, you get better results the earlier you come in. We're able to treat it much more effectively. And
gum disease is how they're losing their teeth.
Yeah, gum disease is how you lose those teeth, because with these people with dentures, a majority of them, they lost them because of gum disease. So if you're able to eliminate that gum disease earlier in their life, before it gets to the point where their teeth are coming out, then you're able to save these teeth. And you're able to get them throughout the rest of their life, where they're 80, 90, 100 years old still with their teeth.
Gum recession, and we literally have about a minute and a half left.
Okay.
So there's two ways to treat recession, people with cold sensitivity. Tell me what they are and how you're doing it.
So people with cold sensitivity, a majority of the time it's caused by gum recession. And if you'll notice, some people have longer teeth. You can see the roots of their teeth. There's some discoloration because the root of the tooth is actually yellower than the crown of the tooth, is what we call it. And with these patients, a lot of them, they're not able to drink cold water or eat ice cream without just getting that cringe of pain. And I want to actually see if I can fix that for them. How it's normally done is, what you do is you cut open the gums, you open these gums up, and you actually cut a big chunk from the palate, a big chunk of gum from the palate, and you suture it over the top there and suture everything closed. As you might be able to tell, that's very painful.
So it's like you're patching from the roof of the mouth onto the receded gum.
Onto the receding gum.
That's how it's always done.
That's how it's been done for 30, 40 years. You're able to cut the gums and actually patch it over and try to pull those gums up. And
you don't like it, obviously.
I don't like it. I'm not a big fan. We used to do that. I did that when I was learning how to do it in my residency years ago, but nowadays we've got a much kinder, much gentler procedure for you, because there's no need to go to the palate anymore.
What is it? You call it a pinhole technique.
It is. It's called the pinhole technique because instead of those big cuts, those big incisions where you actually have to pull the gums away from the teeth there, we're able to just make little pinholes. Little pinholes around the mouth, and we're able to actually go underneath the gums and tunnel underneath to free these gums up, so they basically sag down, and we're able to place collagen strips underneath these gums to bulk them up. And a lot of times we don't need sutures, and it's great because we're able to get these great results. We're able to get these fantastic results without
traditional
sutures,
surgery.
without traditional surgery, without sutures, and the patients love it because it doesn't hurt nearly as much.
Okay.
And patients love it because you don't have to actually go to your palate
So on the upper
anymore.
teeth, so we're talking about gum recession. So the gums, so I understand this correctly, the gums have receded up. They haven't disappeared. They're still there. But
still
they're
there.
like drapes, like pushed up, and you're pulling them down.
We're able to pull them down.
And then with this pinhole, go in and keep them down.
Yeah, we're able to pull the gums down and actually keep them down. And with this procedure, we're able to do, say you have to do all the upper teeth, we're able to do that all in one day. And if you need the upper and lower teeth, we're able to do that all in one day. Whereas with the old procedure, with that what we call connective tissue graft.
This old procedure is being done every day across the country.
Oh, every
today.
day. Thousands
Even
of times
in your
a day.
town?
Even in my town. No. Many people still do it. If you're not trained on the newer techniques, you're going to do what you've been doing for 20, 30 years.
Would you say less than 10% of all periodontists are doing this pinhole?
I would say
pinhole
so.
technique?
Yeah, probably less than 10%. Probably less than 10%. And the great thing about this is we are able to do much more areas than we were able to do with that old procedure, because the old procedure, you've only got so much gum in your palate before you run out. So we're able to do with that procedure maybe 3-4 teeth here, then you gotta let that heal, then do 3-4 teeth here, come back, and then maybe over here. So to do a whole mouth, it'll take maybe 4 or 5 surgeries. It's crazy to be able to do that. And the patients hate it. We're able to do the full mouth all in one day.
Is
all
that
in
right?
one day.
So no more gum recession.
No more gum recession.
Are people mainly coming for appearance because the way it looks, they don't like the way their receding gums look? or they're doing it because of the cold sensitivity?
It's both. You've got patients that come in that some people, they don't have cold sensitivity. For whatever reason, they've got exposed roots but no cold sensitivity. You got patients coming in for that because I had one patient coming in, he said, I'm getting married in a few months. Like, I don't like this recession that I have. Can you do anything for me? And I was able to actually pull his gums down, get those gums nice and healthy, and he looked great for his wedding day. And that was important to him. And I've got other patients where they come in, they say, listen, I can't drink a glass of water without jumping through the roof. And I'm able to actually pull those gums up, and now they're able to drink water, eat ice cream, and the air in their mouth every time they take a breath doesn't bother them anymore. So they're happy patients. And we're able to actually save these teeth because with recession, it starts off little, and every year it gets worse and worse and worse. And you can actually notch out the teeth as a result of it.
So find a periodontist that uses this pinhole technique.
That's what you want
In
to
fact,
do.
you're going to the advanced course here in California.
I am.
Is it later today or tomorrow?
It's actually tomorrow.
So you're like ongoing, always learning new stuff. Is there that much to this?
Oh, there's a lot to it. This is very technique sensitive, so you want to go to somebody who knows what they're doing, because you'll see a lot of less experienced dentists, and even when they've been trained in the pinhole, unless they've done enough cases, they don't know what they can and can't do. So I'm able to actually do it, and I do it well because I've got the experience, I've got the training for it. And I mean, now after tomorrow, I'm going to have the advanced training for it. So it's really great to be able to do that.
Good for you. Okay, we're out of time. So I want to thank you for coming on the show. Final message, somebody with bleeding gums, bad breath, loose teeth, or they've been told they need a bunch of extractions for the laser. What do you tell them?
Get a second
opinion?
Get a second opinion, get it checked out. I've had multitudes of patients, just many patients come in that you know what, they're just downtrodden. They've had dentists tell them you're going to lose all your teeth. And that's not the case a lot of times. We're able to save teeth, whereas anybody else would take them out.
All right, I want to thank you for coming to the show. Great stuff.
Thank you. Thank you so much.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.